than 50 million people worldwide have epilepsy. Nearly 80% of them live in low and middle income countries. Around 50 million people around the world are affected by this disease, means epilepsy. Now today I will discuss about what is epilepsy and signs and symptoms of this.
As you have already discussed, epilepsy is very common, and in the coming days, after a lot of intervention, the percentage of the epilepsy, occurrence of epilepsy is increasing. First I want to discuss what actually epilepsy is. Epilepsy or seizure, recently it is known as seizure, because this term is very stigmatized. In Hindi it is known as mirgi. But due to stigma, after this name, now most of physicians are using the seizure. The seizure is a paradigmal changes in the behavior or the neuronal activity. The change in the changes is paroxysmal, and the manifestation can be related to emotions or sensation or motor, or cognition, decline in cognition. These all comes under the seizures attack. So first of all, I want to classify the broad classification. We can say it can be partial or focal seizure. Then in the partial or focal, again it can be simple or complex. Secondly, which is defined as the primary generalized seizure, which includes the absence seizure or tonic-clonic seizure. Tonic-clonic seizure is also popularly known as the grand mal, and absence seizure is known as the petit mal seizure. It can be tonic, myoclonic, or absence or infantile seizure. It can be the status epilepticus, where the attack is much more lengthy and it includes the whole body. It is prolonged, repetitive seizure, status epilepticus. So, coming to the site, actually it involves any part of the brain, and mostly it involves the temporal part of the brain. Temporal epilepsy is very common, and there is changes in the electrical activity inside the brain. So it involves the potential of the brain changes, and there is attack. It can be focal or generalized. So in short, the pathophysiology is the electrical or chemical structure life. If there is any change in the chemical level, it again manifests in the form of the epilepsy. Or if there is any change in the electrical activity, it also manifests as the epilepsy. So how you record? Is the most diagnostic modality through which we can. There is EEG, electroencephalography, popularly known as. A lot of graph is there, primary wave, secondary wave, and we study the graph, and then we assess which part of the brain, which it is a cortical, subcortical, or where it is focused. So it can be the right or left, cortical part, temporal part, any part of the brain. So what is the mechanism? What is the mechanism behind the epilepsy or seizure? So it may be related to the GABA. GABA is a gamma-aminobutyric acid. It may be enhanced by the NMDA, N-methyl-D-aspartate, or it can be any endogenous neuronal burst. So these are the mechanisms behind the cause of the epilepsy. So now this is a major pathology. What is the most common cause which is really responsible for the causation of the epilepsy? So cause can be varied. Cause can be different according to the age. If the patient is very infantile, so in that case the cause can be different. For the child, cause can be different. Adolescent, adult, older adult, the cause one cause can happen in every group, but most common cause is related to the particular group. So in the infant, most of the time we have seen the perinatal hypoxia. If there is a changes in the oxygen level, deficiency of the oxygen to the brain, supply of the oxygen is less, either through arterial supply or any region, so it can manifest as a epilepsy in infant, which is most common. It can be intracranial birth injury. Most of cases we have seen in the old time, because this is a very high, we are living in a high society. Now the government has planned a lot so that the delivery and the event related to delivery, post-delivery, all these cases has been reduced. So intracranial injury has become reduced. So, but again, in the lower society, in the village area, in the rural area, urban area, there is a difference, and it can be a cause, that is the intracranial birth injury. Can be the infection. Infection is also common cause in the poor society, which really manifests as the epilepsy. Metabolic disturbance can happen there, like the hypoglycemia or hypomagnesemia, or any electrolytic imbalance can induce the epilepsy in the infant. Apart from that, in the child, means the child means the age between 2 to 12 years. In that age group, the cause can be the infection or trauma, because at that age development is going on. Child has the different experiences, so he can be troubled or it can be traumatized. Brain injury can happen. Our brain parenchyma can be affected. So these are the common causes for in the childhood. In adolescent, the cause again can be due to the trauma or any drug affection or any alcohol withdrawal or any, you can say, anticonvulsants or AV malformations. These are the common causes in the adolescent group. In the adult, again the trauma or alcohol can happen. In the older person, a cerebrovascular accident or metabolic causes can happen in terms of the uremia or idiopathic injury or hepatic failure, electrical activity or electrolytic imbalance. These are the common causes in the older age. Alcohol sometimes can be the causative factors. So these are the common factors. In nutshell, we can say infection, trauma, these are the common causes apart from the metabolic causes. These are really, now it can start by the trauma or focal epilepsy again. So we can see there is a changes in the electrical activity due to any particular region, and there is disturbance in the alpha wave or beta wave. The person becomes asynchronized, repetitive synchronization of the hypersynchronous discharge can happen. Mild synchronized activity can happen. So there is asynchronization of the electrical wave, what you find in the EEG, electroencephalography. So there is a common term these days. Seizure is a very common term. So Dr. Chandan, what you would like to say about the pathogenesis of possession or about the seizures? So you tell, please.
Seizures occur due to abnormally increased activation of neurons when two or more unprovoked seizures occurs at more than 24 hours interval. It qualifies for a diagnosis of epilepsy. It has to be treated by a neurologist and epilepsy specialist with appropriate medication. Then I would like to say with you, how do you identify a seizure?
Pardon me?
How would you identify a seizure?
So means you want to say how you diagnose, means diagnosis. But diagnosis is based on one thing, is by the physical symptoms. When patient comes in our chamber, or we can go to the clinic or in the ward, by his expression, by sign and symptom, we can diagnose. We take the proper history, and patient says it may be pseudo seizure or hyperventilation syndrome or anything can happen. Differential diagnosis can be the syncope or interictal or pseudo seizure or transient ischemic attack can be. So we have to diagnose. Now, after taking history and the sign and symptom, taking history, we can go to the investigation like the EEG, and that is electroencephalography, where the lot of electrodes are put around the skull, put in the skulls, and we can assess the activity of the patient. So for evaluation, we also go for the CT scan or MRI, or the lumbar puncture is also performed. So according to the cause, what is the cause? And again, electrical activity can be of different types. So what is the threshold value? What is the how the lead shows the potential? On that basis, we can find the where actually insult is. What is the site of insult? It is cortical or subcortical or parenchymal, or again the cause can be differentiated by the CT scan or MRI. If there is any structural injury, if structural changes is there, then we can tell that this is the site. By this way, we can assess the CT, the epilepsy. But in nutshell, EEG is the most can say believable diagnosis on which we can believe that the patient is suffering from the epilepsy. Now again, I already told that this can be differential diagnosis here also. Patient may suffer from other injury or other diagnosis, but we can misdiagnose the seizure, like we can say syncope. In the syncope, there is also a sudden loss of consciousness without any convulsive movement, and it also happens in the seizure also. So we have go for the other diagnosis, like it can be Stokes-Adams syndrome. So we should go for the MRI. If there is any structural changes, is there any, or video EEG, we know so. Video EEG graph is also very helpful, where we assess the 24-hour electrical activity of the patient. So now, after that investigation and diagnosis, we should go for the treatment of the patient. What is the, so you know, Dr. Chandan, the most common treatment, you know, the Tegretol, the brand name is carbamazepine, oxcarbazepine, phenytoin, ethosuximide, valproate, sodium valproate. These are the common drugs. Apart from that, is the lamotrigine, methotrexate, carbamazepine, gabapentin, melphalan. These are all common drugs which are primarily used. Apart from that, we can go the augmentation therapy also. We can go for the symptomatic relief by other choice of the drug. So these are the drugs mainly used for the benzodiazepine is still very common. Phenytoin is, you know, the 100 milligram is given for the. I would like to tell that in the head trauma or brain injury, traumatic brain injury, to prevent the seizure in the future, phenytoin is given, so that patient doesn't suffer any sort of seizure in the future. Because this head injury is very common, trauma is very common. Patient become unconscious and be admitted in the ICU. And after that, we see that the patient become untreated. Later on, he manifests in terms of the complex seizure or partial seizure. So to prevent such attack, we have to go for some symptomatic in terms of the phenytoin or electrolyte. So any advice what you want to like to say?
A healthy mind stays in a healthy body. Epilepsy can be prevented by following a healthy lifestyle. One should follow a proper meal and sleep schedule, do regular physical exercise, avoid tobacco, smoking, alcohol, and keep stress level under check. Then this way we can prevent epilepsy. And next my question is that कि what causes epilepsy in infant?
I already discussed, Dr. Chandan, that infant, age is 0 to 2 years age. In this patient, what is the insult of the infant? First, before that, I will tell that genetic factor is also influencing the development of the epilepsy, and it shows the different pattern in the age. So, perinatal hypoxia and ischemia, less blood supply or less oxygen or deficiency of the oxygen leads to the electrical changes, paroxysmal changes, in asynchronized activity in the neurons, and it causes the seizure in the infants. Intracranial birth injury, already told that during the delivery it is PPH or APH or something bad happened during that time. This can lead to the seizure. Acute infection, the viral infection, bacterial infection, that is the most positive factor. So cytomegalovirus, that is the most common cause of the seizure. That and we also find in the CT scan in terms of the calcification and other things. These are the common factors. During the albendazole, and for that, the most common is the war infection. Helminth infection is the positive factors for maybe in the child. Apart from that, I already told you metabolic disturbances, like you say hypomagnesemia or any changes in the glucose level or calcium level. These all lead to the seizure or pyridoxine deficiency. Apart from that, congenital factors or genetic factors can also influence the causation of the epilepsy, and the patient in between or person, child in 0 to 2 years are the most vulnerable for these causes. So I think you have been answered. So
One question again from my side. How to help someone having a seizure? If anybody is suffering from seizure, by taking a few steps right away can help in avoiding any types of casualties. First of all, ask people to move away so the person suffering can breathe freely, and second, turn the person onto their side. This will keep them from suffocating on vomit or saliva.
Really.
Do not put anything like water, medicine or any food in the person's mouth, as the person having epileptic seizure can choke. Do not attempt to control or stop the person's jerky movements while restraining them. They can be hurt, so avoid holding them until the seizure finishes.
Yes, you are right. Means by force we can't stop.
Yes.
We have not apply the force. The person suffering from the epilepsy. By gently you have to handle the case.
And a soft towel or cushion should be placed under their head to keep them from harming themselves during the quickly involuntary movements.
Yes, you are very nice. And now, Dr. Chandan, I would like to tell that after so much of the investigation, so much of the diagnosis, so much of the treatment, the cases is still going on. This is still going on, and lot of side effects like the gum hypertrophy and kinky hair, we know the valproate therapy. There are a lot of side effects by the anti-epileptic drugs, and still we are not reaching the point where the acceleration of the seizure can be stopped. Means still the cases of the seizure is increasing in our society, and there is no any we are not reaching the solution of the seizure. So it is very it is very not heinous, but it is very surprising and very frustrating for the society or the doctor fraternity. So anything so I will add for this. Okay, thank you.